My name's Chris Reynolds. I've been working as a general practitioner in Australia since about 1973. In the past 19 years I've been working with a wheatgrass extract, which I've used on many different patients for different conditions, in particular for the successful healing of wounds and burns. But I've also used it on tendon and muscular issues when the muscles are too tight and it loosens them up in many cases. In fact, the next slide will show an example of a patient with burns contractures and how he recovered quite rapidly, in fact in about 10 minutes after the application of the wheatgrass extract. This patient suffered severe burns to the front of his chest and down his arms about 3 months before these pictures were taken, and he was unable to move his arms above the horizontal. If we couldn't go any further than that because of the contractures across his chest holding his arms down. And I applied some of the wheatgrass extract across this area of his arms and axilla, or the armpit here. And about 10 minutes later he was able to lift his arms to the vertical, as you can see in the second picture. This event defied explanation. I'd never seen anything like that in my life before in my clinical career, where we don't see too many phenomena. Now, due to the commonly held belief that established brain damaged patients rarely, if ever, recover, it never occurred to me to see if wheatgrass extract would make any difference to these patients' ability to move their limbs. However, as you will see in the following video clips, I now have reason to seriously question this irreversibility. You will see clear evidence of recovery of active muscle and joint movement, as well as sensation in a stroke patient. Also, you'll see recovery in joint movement in a young child suffering the long-term effects of bacterial meningitis. I saw both of these patients in January 2014 at the Visay Health Centre in Fiji while working as a volunteer. I captured the video clips by mobile phone. Boyer attended for a condition unrelated to his stroke. He had a marked deformity of his left hand, which was clenched tightly, and he was unable to bend his elbow, and his arm was quite flaccid. He could not move the arm out from the side of he couldn't move his arm at all. He had no movement. And he also had a markedly deformed left foot, which was due to tendon contracture and muscle contracture, distorting the normal mechanics of the foot and ankle. More as an afterthought, I said to him, do you mind if I put some of this extract, this wheatgrass extract, on your hand? Not thinking for 1 minute that it would work. And he was quite happy about that, and I did, and I actually had to force the cream, it's in a cream form, into underneath his fingers, like this, because his fingers were tightly clenched. There was no movement there at all. And not expecting any kind of response, I was absolutely amazed when about 5 minutes later he started to open his fingers and his thumb. And you'll see this in the next video clip. This is the original position before we placed the wheatgrass cream on. So the gentleman now will try to open his hand. So if you can just open your hand now, can you do that?
Nice works.
Is that better than you had before?
Yeah.
And now he's got full extension of his thumb. And when did you have your stroke? 5 years ago?
5 years ago.
When I saw him a few minutes ago, he had complete flexion of all those digits and he was unable to extend them at all. 5 days after this incident, I visited Boyer at his home. And by his own initiative, he had used the extract that I'd given him and applied it to his own shoulder and his elbow, to his arm generally. And he found after, he said about 5.5 hours, he was able to then move his arm out from the side and to move his elbow. And the next video will confirm that. Could you just move your left arm out from the side? No, straight out from, all right, that's something. Could you do that last?
No.
Could you do that on last week when I saw you 4 days ago?
No.
Could you move your arm out that way when I saw you before we used the wheatgrass cream?
After using the cream.
After using the cream?
Yeah.
How long after using the cream were you able to do that?
About 5.5 hours.
5.5 hours
Yeah.
after you used that. Okay, now I'd like you to walk across the floor. Boyer is now demonstrating how difficult it is for him to walk. He's walking on the side of his foot because of the contractures on his foot and his ankle, and he's walking also on the tips of his toes because he can't put his foot flat on the floor. He's also finding it very difficult to move forward, so it's a slow and painful process for him to walk anywhere. Is that how you normally walk?
Yeah.
You have to like shuffle.
Come again?
You can't walk any faster than that?
No.
Okay, just keep walking for me. Okay. Now Boyer demonstrates how he can stand without assistance. Before he always had to have somebody to pull him up out of a chair. He stands up abruptly and with ease, and then he demonstrates how he used to walk and how he's walking now on the flat of his foot and not on the end of his toes and on the side of the foot.
No pain here.
No pain there?
No pain here.
Yep.
I can walk, see? I can put my legs straight, see?
Yep. Now if you go back again, could you just walk like in a normal way, like the best you can, just put your foot out and then walk? Good. And do you feel that's better than what you could do 20 minutes ago?
It's big difference.
Big difference.
Before it was like this.
Yep.
Like this.
Yep. And now?
And now I can put it straight.
Yes, I can see the difference there. Your foot was turned inwards quite markedly, like that. Yep.
Yeah.
And now you've got. So now you've got a full area of foot to walk on.
Yeah.
And you're not walking on the side of your heel.
Yeah. Before it was like
of your
this.
Foot. Yep.
Now I can put my whole leg.
Yep. So were you able to support your body on that left foot before?
No. But now I can.
You can. Also, he can show how he can actually stand on one leg, and that's his stroke side, which is something he certainly couldn't do before we used the extract on his leg.
Before when I want to,
Yep.
I have to hold something on top, like this.
You had to hold something.
Yeah.
But now you don't.
No, I don't. See, I can.
Can you do that again? You can stand on that one foot.
Yeah, I can now. See.
That's remarkable. On day 10, Boyer arrives in very high spirits to the clinic, where he tells me that he's now driving the family car for the first time in 7 years. This represents a considerable increase for improvement in his quality of life. This is Boyer and his wife Basant. He's coming over now, and he's going to get in the car and drive his wife home. See you later.
Okay.
Yep. This 4-year-old girl's mother heard about what happened to Boya through the community grapevine, and she came to see me with her 4-year-old daughter who suffered bacterial meningitis when she was 7 months old. Since that time she's been completely spastic in all 4 limbs, and she has no head control, and she has cognition but no speech. So continued intensive physiotherapy eventually managed to enable limb movement. Although her left knee could be bent passively, she was unable to bend it voluntarily. Her mother wondered if wheatgrass extract might help. I promised nothing but offered to try. In this video, I'm applying wheatgrass extract, and within about 5 minutes towards the end of the clip, much to her mother's delight, Inise suddenly bends her stiff left knee.
Before the left side never used to respond. This left side always.
It didn't respond.
Never used to respond. It's only the right side.
So she can bend her knee?
Now we do it for her. If we put, like, if we tickle this, she hardly feels it, eh?
Yeah.
This one, yeah.
Yeah, okay. Well, we'll just put some under there. And we should pull her. What we'll do the whole leg. Because it's very, very safe, right? That spray you can drink. So she hasn't been able to move that. She hasn't been able to bend that knee at all. So this is
The left side, the left side.
This is about 10 minutes, I suppose. Barely 10 minutes. And now, is she responding to your finger, do you think? She doesn't normally do that. And she's bending her left knee. She doesn't normally bend her left knee. Is that right?
She doesn't. Only the right side there.
Yeah.
She's responding.
She's responding. Where she hasn't responded before. Never. Is that you're saying that she's never
The left side though.
never responded, but now she's responding.
She's responding fully.
So before, when you scratched her foot, she didn't pull it away.
No.
So she's obviously regained some sensation in the sole of her foot. Look at the way she's bending that knee up. She's making voluntary movements of that left leg, which before was completely stiff.
Stiff. I have to do it for her.
And immovable. The improved outcomes of both these patients should not be taken to mean that wheatgrass extract will ease tightened muscles, tendons and ligaments in all brain damaged patients. No one knows what the outcome might be. They are, however, 2 genuine case histories I managed to record. How did wheatgrass work for these 2 patients? I don't think anybody knows, but the rapid response may suggest wheatgrass extract contains bioactive molecules that reactivate dormant neural pathways to the brain, which then responds to stimulate muscle movement. Alternatively, perhaps there are alternative pathways to the brain which so far have not been recognised. Whatever is happening, the response from the brain to remobilise any joint must be comprehensive and substantial. Thank you.